Pregnancy is a unique and life-changing experience, and recognizing the early signs can help you prepare for the journey ahead. While every woman experiences pregnancy differently, there are some common symptoms that might indicate you're expecting. Paying attention to these signs can be helpful, but it's also important to confirm any suspicions with a healthcare professional. One of the earliest and most noticeable signs of pregnancy is a missed period. If your menstrual cycle is regular and you suddenly miss a period, it could be one of the first indicators. However, stress, hormonal changes, or lifestyle factors can also cause a delay, so it's important to consider other accompanying symptoms. Morning sickness, which includes nausea and sometimes vomiting, is another common sign. Despite its name, it can occur at any time of the day. Hormonal changes during early pregnancy are often the cause, and while it can be unpleasant, it's generally not harmful. Some women may experience it as early as 2 weeks after conception. Tender or swollen breasts are another clue. During early pregnancy, hormonal changes can make your breasts feel more sensitive or heavier than usual. This symptom can also include darkening of the areolas or the appearance of more pronounced veins in the breast area. Fatigue is another frequent early pregnancy symptom. The increased levels of progesterone in your body during the first trimester can leave you feeling unusually tired. This can happen even if you've been getting plenty of rest and eating well. Food aversions or cravings may also occur. Many women notice sudden changes in their appetite or the way they react to certain foods. You might develop a strong dislike for foods you once enjoyed, or crave foods you typically don't eat. Sensitivity to smells is also common, as your heightened sense of smell might make certain aromas overwhelming. Frequent urination is another sign that might indicate pregnancy, as your body adjusts to hormonal changes and begins producing more blood. Your kidneys work overtime to process the extra fluid, leading to more trips to the bathroom. Some women experience light spotting or cramping in early pregnancy. Known as implantation bleeding, this happens when the fertilized egg attaches to the uterine lining. It's usually lighter and shorter than a typical period and occurs around the time your period would normally start. Mood swings can also be a sign. The hormonal changes that happen during pregnancy can affect your emotions, causing you to feel more sensitive or irritable than usual. This emotional shift can occur alongside physical symptoms and might be more noticeable if you typically have a stable mood. Other potential indicators include constipation, bloating, and increased basal body temperature. Some women report a metallic taste in their mouths or an increased level of thirst. Additionally, you may notice changes in your skin, such as acne or a sudden pregnancy glow. It's important to note that many of these symptoms can also be related to other conditions or lifestyle factors. For instance, fatigue and nausea might be linked to stress or an underlying health issue, while bloating and tender breasts could be signs of premenstrual syndrome. If you suspect you might be pregnant, the next step is to take a home pregnancy test. These tests are designed to detect the presence of the hormone HCG in your urine, which your body produces after a fertilized egg attaches to the uterine lining. For the most accurate results, take the test after your missed period. If the test is positive, schedule an appointment with your healthcare provider to confirm the pregnancy and begin prenatal care. On the other hand, if your test is negative but you still suspect you're pregnant or continue experiencing symptoms, consult your doctor. They can provide a blood test or ultrasound to determine if you're pregnant and rule out other potential causes for your symptoms. Understanding the early signs of pregnancy can be both exciting and overwhelming. Every woman's body reacts differently, and not everyone will experience all these symptoms. Trusting your instincts and seeking medical advice when needed are the best ways to ensure you get the care and support you need during this time.